Avoid infections with the best professionals for thorough wound care assessment and wound dressing services. Dr. Bill Relaford, a leading figure in wound management behind the Wound Pros, WP, is deft in utilizing Rita and Bates Jensen apparatus. These renowned devices are acclaimed for their precision, facilitating a comprehensive analysis of injury dimensions, depth, and category. His adept manipulation and innovative approaches significantly amplify the efficiency of wound treatments. These groundbreaking methods wound care pros use have transformed the realm of injury management. WP's input has been pivotal in enhancing patient service quality, particularly in complicated injury cases. WP has triumphed in questioning the accepted standards and introducing resourceful and effective tactics that have proven advantageous for patients. The primary goal extends beyond merely healing the injury. WP strives to improve patients' overall wellness, ensuring superior recovery and an enhanced lifestyle. Key takeaways. 1. Dr. Bill Relaford and the Wound Pros provide experienced leadership in wound care, using both Bates Jensen and Rita tools for thorough examination. 2. The Rita tool allows for systematic wound evaluation, but is not as effective for pain assessment. 3. The Bates Jensen tool offers a comprehensive approach, considering both overall patient health and detailed wound features. 4. The goal of these approaches is to improve patient outcomes in wound care. Understanding wound assessment tools. Numerous assessment tools exist for wound evaluation, specifically designed for precision and accuracy when dealing with various wound types. Professionals in wound care rely on these resources to categorize wounds, a critical step in ascertaining the most suitable treatment. Greater accuracy leads to quicker wound classification and treatment, minimizing complications and expediting healing. Tools such as Bates Jensen Wound Assessment Tool along with Rita Wound Assessment Tool are in regular use as a wound assessment tool for nurses due to their established efficacy and user-friendliness. On the other hand, wound classification helps in understanding wound depth, size, and category, which can have an impact on the treatment selection. Tools such as Pressure Ulcer Scale for healing, PUSH, facilitate easy classification while monitoring wound healing progression. Dr. Bill Relaford's leadership. In wound care, leadership of Dr. Bill Relaford has made significant advancements. His expertise, combined with innovative techniques, prove beneficial to both healthcare providers and their patients. His leadership, marked by strategic thought, open dialogue, and teamwork, has acted as an agent for change and progress. Among the remarkable innovations include 1. Application of novel wound healing techniques which have significantly reduced recovery times. 2. Integration of state-of-the-art technologies for wound examination and therapy. 3. Formation of educational outreach to provide patients with a baseline understanding of advanced skills in wound care. The Wound Pros has adopted these thorough methodologies across many patients, ultimately enhancing patient outcomes. Excellence in communication and dedication to patient care all exemplify WP's qualities as a true wound care leader. Rita Wound Assessment explained. Rita, a wound assessment tool, was crafted by healthcare experts to assist in methodically evaluating the progression of wound healing. Its systematic approach relies on 5 fundamental parameters: redness, edema, ecchymosis, discharge, and approximation. Such a method promotes a consistent, unambiguous sense of factors vital in tracking patient progress. Nonetheless, this tool bears limitations too. Its scoring system might not completely elucidate the intricacies of diverse wound types, leaving room for subjectivity. For example, evaluation outcomes could waver based on the expertise or experience of the assessor. Despite these drawbacks, its value in wound care management remains undeniable. Offering a tangible, structured process for wound evaluation, this tool proves instrumental in directing treatment decisions. Pairing this with other assessment techniques and clinical judgment can lead to optimal outcomes, guaranteeing patients receive highly effective, personalized wound care. Bates Jensen Wound Assessment. Another assessment tool is the Bates Jensen Wound Assessment, which offers a comprehensive methodology for monitoring wound progression. It has a 15-item objective measure that enables practitioners to meticulously track the healing process. Effectiveness of this tool lies in its specificity by facilitating measurement of wound characteristics under 3 primary categories: wound size, wound depth, environmental conditions around the wound. This approach is holistic, considering not just wound's physical attributes, but also surrounding area and patient's overall fitness. Such comprehensive consideration gives a rounded picture of the healing process and potential complications. In essence, this wound assessment provides a detailed look As an important resource, it enables precise, accurate, and efficient monitoring and treatment of wounds. For wound care experts, this tool is indispensable in ensuring the best results for patients. Diabetic foot ulcer. Diabetic foot ulcers, otherwise known as DFU, pose a significant risk factor for those with diabetes, often resulting in severe health consequences. These ulcers are caused by a mixture of peripheral neuropathy, peripheral artery disease, and frequently, an overlaid infection. This is where the application of expert evaluation instruments like RITA and Jensen Bates becomes essential. RITA offers a straightforward and user-friendly means of examining sores. Inflammation or infection may be indicated by a reddened area around the lesion. Swelling or edema could suggest a continuous inflammatory reaction. Ecchymosis or discoloration may suggest damage to the affected region. Discharge is also a critical indicator, as a change in color, texture, or smell may suggest an infection. Finally, approximation, which refers to the lesion's edges. If they aren't converging as expected, this might suggest a problem in the healing process. Contrastingly, the Jensen Bates evaluation places a particular emphasis on the lesion's appearance, including its size, depth, and the surrounding skin's health. It takes into account the lesion's discharge or exudate and any smell that may exist. It also assesses the presence of necrotic, granulation, and epithelial tissue. This evaluation instrument is more detailed and offers a comprehensive perspective of the lesion's overall health. Utilizing both evaluations in lesion management can provide a complete picture of the lesion's health and the patient's overall well-being. Frequently asked questions. What is included in a wound assessment? A wound assessment typically includes a thorough evaluation of the patient's overall health and their healing ability, an examination of the wound's location, size, depth, and type, identification of signs of infection, assessment of the wound tissue and any surrounding damage, and a review of the patient's pain level. What are the 6 key principles of wound assessment? The 6 key principles of wound assessment start with the identification of the wound type and its cause. This is followed by an evaluation of the patient's overall health, which is crucial to determine their potential to heal. The third principle involves a detailed assessment of the wound's characteristics, such as its size, depth, and location. The fourth principle requires checking for any signs of infection or complications that may affect the healing process. The fifth principle is the assessment of the wound's stage or phase of healing, which helps in planning appropriate care. The final principle emphasizes the importance of regular reassessment of the wound and thorough documentation of its progress. What are the 9 parameters that are included in a wound assessment? The 9 parameters that are included in a wound assessment are wound location, wound size, length, width, depth, wound stage or grade, wound exudate, amount, color, consistency, and odor, wound tissue type, wound edges and surrounding skin, signs of infection or inflammation, level of wound pain, and the impact of the wound on patient's quality of life. How do you document wound findings? To document wound findings, you need to detail the appearance of the wound, including size, shape, color, and any noticeable odors. Note any signs of infection such as redness, swelling, or pus. It is also important to record the patient's pain level and any changes from previous assessments. Using a standard wound assessment form can help ensure consistency and thoroughness. How does a nurse assess a wound? A nurse assesses a wound by first ensuring the area is clean to prevent infection. They then examine the wound and surrounding area for signs of healing or complications. This includes checking for changes in size, color, temperature, smell, and pain level. The nurse also assesses the patient's overall health and ability to heal. How to assess wound healing? Wound healing is assessed by looking for signs of reduction in size, decrease in exudate, growth of new, healthy tissue, and absence of infection. Progression from red, granulating tissue to lighter, epithelializing tissue is a good sign. Pain should also decrease as the wound heals. How do you assess and perform wound care? To assess and perform wound care, first cleanse the wound with a suitable solution to remove debris and bacteria. Assess its size, depth, and any signs of infection. Choose an appropriate dressing that will maintain a moist healing environment. Change dressings regularly and reassess the wound each time. How to chart wound assessment. Charting a wound assessment should include the wound's location, size, depth, stage, exudate, tissue type, edge condition, surrounding skin condition, signs of infection or inflammation, pain level, and impact on patient's quality of life. Any changes from previous assessments should be noted. Which information should be documented after assessment of a wound? After assessing a wound, the following information should be documented: patient's overall health status, wound description, size, type, location, color, odor, signs of infection, pain level, treatment plan, and patient's response to treatment. How to tell if a wound is healing or infected. A healing wound typically decreases in size, produces less exudate, and the wound bed gradually fills with new tissue. Signs of infection include increased pain, redness, heat, swelling, pus, foul odor, and sometimes fever. Also, if the wound isn't reducing in size over time, it may be infected. What does a black scab mean? A black scab often indicates necrotic tissue, which is dead tissue that needs to be removed for the wound to heal properly. However, it can also be a sign of a healing process where the scab is drying out and getting ready to fall off. Always seek medical advice if you're